Doctor, I've been having these terrible stomach pains and fevers too, sometimes even my chest and joints hurt. It comes and goes, but it's been happening for a while now. I'm really worried. Dr. Magdy listened patiently, his gaze warm and reassuring. He asked about the young man's medical history, his family, and how often these episodes occurred. He learned the young man was of Egyptian heritage, and the symptoms sounded familiar.
From what you describe, it sounds like it could be Familial Mediterranean Fever, or FMF. It's a genetic condition more common in people of Mediterranean descent.
FMF? I've never heard of it. What is that?
Don't worry, it's not as scary as it sounds. Let me explain. FMF is a genetic condition. This means it's something you're born with. It causes episodes of fever and inflammation, which is what causes your pain.
The young man was a visual learner, so Dr. Magdy pulled out a diagram of the body.
See? Inflammation happens when your body's own defense system, your immune system, overreacts. With FMF, this overreaction causes inflammation in different parts of your body, like your abdomen, chest, and joints. This inflammation is what causes the pain you're feeling. It comes and goes in episodes or attacks, which is why you don't feel it all the time. Now, let's talk about what causes FMF. Familial Mediterranean Fever, or FMF, is a genetic condition, meaning it is passed down through families. It all comes down to your genes. Genes are the basic units of heredity and are made up of DNA. They carry the instructions for making proteins, which do much of the work in our cells. Genes are like blueprints passed down from parents to children. These blueprints determine many of our traits, from eye color to how our immune system functions. Sometimes there's a small change or mutation in a gene called the MEFV gene. This gene is crucial for the proper functioning of our immune system. Think of it like a typo in the blueprint. Just as a typo can change the meaning of a sentence, a mutation can alter the function of a gene. This typo can cause the MEFV gene to not work properly. When the MEFV gene is mutated, it can lead to the production of a faulty protein.
He saw the confused look on the young man's face and clarified. The doctor explained that understanding this gene is key to understanding FMF.
The MEFV gene is responsible for making a protein called pyrin. Pyrin plays a critical role in regulating inflammation in the body. Pyrin normally helps control inflammation in your body. It acts as a regulator, ensuring that inflammation occurs when needed and stops when the threat is gone. But because of the typo in the gene, the pyrin protein doesn't work as it should. This malfunction means that the inflammation process is not properly controlled. This leads to the overreaction of your immune system and the episodes of inflammation. These episodes can cause severe pain and discomfort, often without any apparent trigger. It's like having a faulty switch that can't turn off the inflammation when it's supposed to. This constant state of inflammation is what leads to the symptoms of FMF, which can be challenging to manage without proper treatment.
So if it's genetic, does that mean I inherited it from my parents?
That's right. FMF is passed down in what we call an autosomal recessive pattern. Everyone inherits 2 copies of each gene, one from their mother and one from their father. In FMF, you need to inherit a changed copy of the MEFV gene from both parents to develop the condition. This means that even if your parents carry one changed copy of the gene, they may not have symptoms themselves. They are considered carriers. But if both parents are carriers, there's a chance that their child could inherit the changed MEFV gene from both of them, Dr. Magdy explained. Familial Mediterranean Fever, or FMF, is an inherited condition, and understanding how it is passed down can be crucial for families. He drew a simple diagram to illustrate the different possibilities. The diagram showed the various combinations of genes that a child could inherit from their parents. If both parents are carriers, there's a 25% chance their child will inherit 2 normal copies of the gene and not have FMF. This means the child will be completely free of the condition and will not pass it on to their own children. There's also a 50% chance the child will inherit 1 changed copy and be a carrier like the parents. In this case, the child will not show symptoms of FMF but can still pass the gene to their offspring. And finally, there's a 25% chance the child will inherit 2 changed copies and develop FMF. This means the child will experience the symptoms associated with the condition and will need medical management. It's like flipping a coin twice, Dr. Magdy said. Each flip represents a 50-50 chance, just like the inheritance of the gene. Each flip has a 50-50 chance. The first flip could land on heads or tails, and the second flip is independent of the first. To get 2 heads in a row, you need both flips to land on heads. This is similar to the child inheriting 2 changed copies of the gene. Of course, this is just a simplified explanation, Dr. Magdy added. The actual process of genetic inheritance can be more complex, involving many factors that can influence the outcome. Genetics can be complex, and it's always best to talk to a genetic counselor if you have specific concerns. They can provide personalized information and support, helping families understand their genetic risks and options. Now, Dr. Magdy said, turning back to the young man, let's talk about your symptoms. You mentioned stomach pain, fever, chest pain, and joint pain. These are all common symptoms of FMF. He explained that the episodes of pain and fever could last for a few hours or even a few days. The severity of the attacks can also vary. Some people have mild symptoms, while others experience more severe pain. Dr. Magdy listed some other symptoms that could occur during an FMF attack: muscle pain, skin rashes, swollen and painful joints, especially in the ankles and knees, and pain and swelling in the scrotum. It's important to remember that not everyone with FMF experiences all of these symptoms, he added, and the frequency of attacks can also vary from person to person. While FMF itself is not life-threatening, Dr. Magdy continued, it's important to manage it properly to prevent potential complications. One of the most serious complications of FMF, he explained, is amyloidosis. Amyloidosis occurs when a protein called amyloid builds up in organs, particularly the kidneys, he said. Over time, this buildup can damage the organs and lead to kidney failure. Dr. Magdy pointed to the diagram of the body again, this time highlighting the kidneys. Early diagnosis and treatment of FMF are crucial to preventing this complication. Another potential complication of FMF is infertility, particularly in men, he added. However, with proper treatment, the risk of infertility is significantly reduced. Now, to determine if you have FMF, we need to run some tests, Dr. Magdy said, turning to his computer. First, I'll ask you some more questions about your symptoms and family history. Then, we'll do a physical exam. He explained that there's no single test to definitively diagnose FMF. Diagnosis is usually based on a combination of factors, including your symptoms, family history, and response to treatment. Dr. Magdy continued, we may also order some blood tests to look for signs of inflammation and to rule out other conditions with similar symptoms. In some cases, we may also recommend genetic testing, he added. This can confirm the diagnosis and help determine the specific gene mutation involved. I understand this is a lot to take in, Dr. Magdy said, noticing the young man's concerned expression. The diagnosis of familial Mediterranean fever, or FMF, can indeed be overwhelming at first. It's natural to feel worried and uncertain about what lies ahead. But I want to reassure you that FMF is a manageable condition, especially if we catch it early. Early diagnosis and treatment can significantly improve your quality of life and help you avoid potential complications. He explained that the mainstay of treatment for FMF is a medication called colchicine. This medication has been used for many years and has a proven track record of effectiveness. Colchicine is very effective in preventing FMF attacks and reducing the risk of complications, Dr. Magdy said. By taking this medication regularly, you can significantly reduce the frequency and severity of your symptoms. It works by reducing inflammation in the body. Inflammation is a key factor in FMF, and by controlling it, we can help you feel better and prevent long-term damage to your organs. He went on to explain that colchicine is typically taken daily, and the dosage is individualized based on the patient's needs and tolerance. It's important to follow the prescribed dosage and not to skip any doses, as this can affect the medication's effectiveness. In addition to medication, there are also some lifestyle modifications that can help manage FMF, Dr. Magdy added. These changes can complement your treatment and help you maintain a healthier lifestyle overall. These include getting enough sleep, managing stress, and eating a healthy diet. Adequate sleep helps your body recover and function properly, while stress management techniques like meditation or yoga can reduce the frequency of FMF attacks. It's important to remember that you're not alone in this, Dr. Magdy said, placing a reassuring hand on the young man's shoulder. There are support groups and resources available to help you connect with others who understand what you're going through. With proper treatment and support, you can live a full and active life with FMF. Many people with FMF lead fulfilling lives, pursuing their passions and enjoying time with family and friends. He smiled warmly. We'll work together to create a treatment plan that's right for you. Our goal is to help you manage your condition effectively so that you can focus on living your life to the fullest.